with some of these questions here that we have. Okay, one that came in that was a follow-up to the question that we talked about sleeping last week, and we talked about Tranquil Sleep. And they wanted to know, Tranquil Sleep, is it to be used alongside with melatonin, or just try Tranquil Sleep alone? It has melatonin in it, doesn't it?
Yeah, it has 3 milligrams of melatonin in it, as well as theanine and 5-HTP, tryptophan.
Okay, fabulous. So I wanted to make sure that we got that covered. Okay, there was somebody else, and I don't know why I can't find it here, but somebody wanted to know if it's common for kids on the autism spectrum to have gray hair. If that's something.
No. Okay. I could just say that I don't believe it's common. I think I don't even have to know the literature on it, because I've seen thousands of kids with autism, and I'll say no, it's not common. If you have a child who has gray hair, that's sort of a genetic thing that can be passed on.
Okay, and they're in particular, because I found it now, is it common for ASD kids to have gray hair? Could it be because of any particular vitamin deficiency?
That I don't know about, okay. But no, it's really not common. I would say I haven't seen children like that. There is a genetic streak that essentially produces one streak of gray hair, which, you know, people can pass on. It has really nothing to do with autism. I'm not sure what you'd be having to look at. I can't think of what vitamin would lead to pigmentation issues, so I'm not sure about that.
Okay. Another question that we have here, is there a book or something that I can give my mother-in-law to get her to understand autism, ABA, and why she needs to support us and stop rewarding tantrums? I'm fed up.
Yeah, that's a really good question. We're in the process of writing our book, Card Book, which is kind of turning into a massive book, actually, but it will be out next year, because our deadline for turning it into the publishers this end of this year. And so that will be a very, very clear sort of and very comprehensive book about ABA and autism and so on. And because we're starting some courses for community colleges right now, we were looking at books that are out there to see what we could use until our book comes out. Yeah. And it's very hard to find books that are well written yet not too technical.
Right.
There are a few. I think if you should possibly start with some story type books, novel, rather than going into like technical ABA. And of course, my favorites would be About a Boy and Let Me Hear Your Voice, because I think they kind of go into, is this About a Boy?
You mean Christina Adams?
Yes.
It's A Real Boy.
A Real Boy, I'm sorry. I'm mixing it up with the movie. A Real Boy and Let Me Hear Your Voice. Those two are, the story captures you so much that you learn somewhat about what ABA can do and what it can accomplish.
Yes.
So I remember giving some books to my mother years ago so that she would kind of get the idea, and she loved A Real Boy very, very much. It's a real book. Easy read and fun to read, Christina Adams. And Let Me Hear Your Voice is a little bit older. It's Catherine Maurice, and that's a very good book as well. So that's where I would start. And then if she reads those and becomes interested, then by then we'll have the card book out, and
there you go.
Send you that.
And I wonder too, just on a side thing, because I remember giving my mother A Real Boy, and my mother read A Real Boy, and I thought that it was really, really helpful. And somebody asked me about this recently, and I said I would give A Real Boy, and then I would also ask them to watch a couple of episodes of The A Word.
Oh, that's a great idea. Yeah. That's a very good idea, I think, because The A Word is our series here, which is fabulous, and it covers a little guy who goes through, and I think it's pretty much every week or
I think there's a new episode that comes out every other week now, because he's a little bit older. Yeah. And so, but there are so many episodes on their YouTube channel, and I think it does a really good job of encapsulating little moments along the way of seeing what ABA does for a child, and what it does for the family, and how frustrating it can be sometimes, and how your home has other functions while you're going through ABA than just having your mother-in-law come over and have coffee whenever she wants. Right.
It's so true. It's so true.
And the whole idea of why we don't want to reinforce a tantrum is throughout that series. So So
yeah, it's hard. I mean, you have to understand, because grandparents always want to spoil the grandchild. That's part of being a grandparent. But it is difficult. But I think these are the best ways. I mean, you're right. The video series will show you a lot of situations where giving attention is not good, and how you can change behavior. So yeah, that would be very good. I really couldn't find. I did pick a book ultimately for our course series, which is sort of less technical, but I don't remember the name of it right now. So if this writer or viewer wants, I can certainly give that information to you once I go upstairs.
All right, great. Yeah. Another question that I promised yesterday that I would have you weigh in on: how to redirect lining up. My son is 3 and just recently started doing this many times throughout the day with different things. As soon as I tell him that that's not the way he's supposed to play or whatever it is, he stops, but as soon as he forgets, he does it over again.
Yeah, so lining up is, I mean, the way to block it or prevent it, you just have to destroy the line, right? And you have to constantly destroy the line. And lining up is an obsessive behavior, sort of. It's classified under self-stimulatory behaviors, but really it's sort of one of the obsessive compulsive behaviors, right? So it's a compulsion. And compulsions, as I've always said, indicate anxiety. So when you have a child who lines up, it could be a visual self-stimulatory as well. Like, some of our kids line up and then they kind of look at the line in a certain way. Other kids line up because they want some form of order in their environment. And it's funny, because to me, autism is a little bit more complex than just obsessive compulsive disorder. And it might be that their visual field is so disorganized. In other words, it might be that what's coming at them, like for us, visually, we have a base, like a background, and 4 figures that are on top of it. But imagine if everything was just floating in air, right? And you'd want to organize your visual field somehow.
Yeah.
And so it might be that that's the reason they need it. But regardless, what I'm saying is it does tend to be, the reason that we line up is to gain control over our environment, is to I guess, organize and so on. So I would replace this with something else that allows the child to feel a little bit less anxious, more safe. And also perhaps it's something that has to do with organization. Like, you realize we do a lot of things that are obsessive, but they're okay. So, like, you could have the child organize books on a bookshelf. You could have the child, organize papers in a thing, or like pencils or pens, or even clothes in a drawer, or whatever. Things that are okay to organize.
Those are great life skills.
They're efficient, exactly.
You can't work at the Gap unless you have those skills.
There you go.
In
fact, that's a good point. It's like the child might like doing things like folding, because it's a neat and organized thing. Otherwise, I don't know. I mean, you can also, a lot of our kids tend to also, who like to line up, and by the way, lining up has decreased over the years, which is sort of interesting when I think about it. But a lot of our kids like trains because of that, because they have to put tracks together, and it's a line of train tracks. But then on the other hand, you could also, the child might also be interested in things like alphabet, which is like lined up in some forms, but replace it with something that's functional is really what I'm saying. Because blocking something that repeatedly happens will always come back. And you block it, it'll always come back in some other form.
Okay, great advice. We're going to take a break and come back and have Dr. Granpeesheh answer more of your questions on Ask Dr. Doreen after these messages. Stick with us. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, a true visionary in the field of autism, an expert in the field who's been working in the field for well over 30 years, we established this morning. But so thrilled to have you here and have you asking questions, answering questions. We're asking you questions. And we had a question that I think cuts right to the heart of a whole lot of things. And I know that you are a great person to answer this question. Why does ABA cost so much?
Right. So that's very good, actually. Well, so let's look at that. it costs a lot and let's start with the very first reason. It is unbelievably intensive. Okay, so it's funny because one of the insurance companies, the chief medical officer and I were having dinner, and she said to me, I don't think we've ever had in the history of insurance funding any intervention that is this intensive, right? And nothing really even comes close to it, because if you think of speech or anything else like that, they're like, a couple of times a week. And ABA is maybe 2 to 3 times a day. 2 to 3 times a day, and it's 1-to-1, right? So in other words, if your child is receiving a 40-hour program, that means there's some paraprofessional providing 40 hours of intervention for your child and not doing anything else. So that means that what you have to pay for is the equivalent of that paraprofessional's entire salary, right? I mean, and what we actually do in ABA, as you know, is we'll take 5 people and add up 40 hours, but regardless, it's a 1-to-1 exchange almost. So it's almost like one full-time job. Okay, so on top of that, you have a supervisor who also overlaps and may spend somewhere about, I would say, 2 to 4 hours a week of working on your child's case. If your child's going rapidly, then more hours and so on. Programming, writing reports for your insurance so that they can get funding, et cetera, et cetera. And so that adds on top of it. And the training that's required, so like you can't even imagine, Shannon, like we now are setting up this community college program where and we're also setting up, we're just about to get approved. I don't want to jinx it, but we're just about to get approved with East LA College, because this lady who we had met at Pierce actually moved to East LA, and she's setting up a program with us which is for returning veterans. And so it's a work preparation program, which once we are approved, we can do this across the whole country. And so what we do is we're going in and training people to the minimum regulations of SB 946. SB 946 is the law, the mandate, the insurance mandate in California. And the minimum requirements to give ABA therapy in the state of California are, for the paraprofessional, are about 30 hours of class time, as well as 6 months of experience. So we're training these veterans, and we've set up a program to train returning veterans in that position. Wow. And then to be able to offer them jobs at CARD all over, because you know we're always looking for therapists, right? And apparently the what's interesting is the majority of the veterans that will be coming into our program are female, which I didn't even realize, which is great because most of our therapists are female as well. And as you know, we always love the guys as well, because the kids love the guys. Yes. But anyway, so it takes a bit of training, and that's the junior therapist entry level. We're talking 6 months of experience, right? So with children of different levels, which is overseen and supervised, as well as 30 hours of coursework, right? That's pretty much like it's almost like a course at university. Now you take all of that and you enter the field at, I don't know, close to maybe $18 to $20 an hour. And an organization that is like CARD, for instance, that has over 1,000 therapists all over the country, is also giving you benefits. Like we also provide all of our staff a lot of benefits, not just health, medical, visual, whatever else, which adds on to the expense. But also things like we have to, and we do, pay our staff when they drive. Right. So our staff is driving from your house to another house to another house and so on. And so what happens is there's a lot of drive time, which they're being paid both mileage and time, which adds up quite a bit as well. So an individual who's getting paid, let's say on the average $20 an hour, and this is the junior therapist level, 18 to 20, will actually cost the company more like 24 or so an hour. And so if you really think about the cost of doing 40 hours a week, just at even, let's say, $25 an hour, it adds up. That's when it becomes very expensive. And on top of that, don't forget there's the supervisor. And supervisors, all of our supervisors, and most insurance mandates now require this, are board certified and or licensed. So you're talking about a professional who is now board certified, and these are people who enter the field at about $75,000. They enter the field with a salary of $75,000. And at CARD, we really are very, very strict about the supervisor training. So they go through a massive amount of training with us, during which time, by the way, we're paying them, but we're not really billing them because they're in training. So it's kind of it does become very difficult and expensive to provide quality staff. And with added to that, of course, is the fact that it's very intensive, and they drive, and all of these additional costs, So that's why it adds up. We are now, as you know, many of our sites, I'm not sure how many, but of the 25, probably at least half are providing center-based model, which is kind of good for families because you could drop your child off at our center. It reduces our costs a little bit, which is driving, and it also allows you to be able to go do other things or go to work.
And it also, I think, provides a ready place when kids need to interact with other kids. It's an amazing thing. It's thrilling that's where autism is going.
It really is. And I don't know how other agencies or owners of other agencies deal with these issues, but I would say the vast majority of our kids are funded, so not a lot of our families are private funding, and we have, and the National Institutes of Mental Health or National Institutes of Health has actually published this. We've put easily between, I would say, 800,000 to 2 million back into research every year. So the company is not producing massive profits. Everything that we make goes back into autism. And so but nevertheless, having said all that, it's hard for families. I completely get it, which is why I've spent a lot of my life helping families try to gain new sources of funding. Right now, insurance is the main way to go. We have some problems with insurance. We're trying to work that out. We're trying to, and if it's okay, there's something that I'm pretty passionate about that I want to say on the show, because very shortly we will be really trying to get this news out. We're having a lot of problems with some insurance companies canceling our kids or denying cases. And some of the reasons for these denials are just atrocious. They're not acceptable. I mean, CARD is well known in the industry for the quality of the intervention and the data. I mean, we take massive amounts of data on our children, and now Anthem Blue Cross of California is specifically telling us that our children over the age of 10, we need to provide graphs going back to the beginning of their intervention, regardless of whether or not Anthem funded it. It doesn't matter if it's 8 years ago, and they want raw data and graphs. And so we're talking, in some cases, and particularly, they're saying we're not convinced. I mean, this is statements that have been said to us. We're not convinced that ABA is in any way effective for children over 10. And if you start going there, this could be someone's opinion. I don't really care. This is not the law. And so you are actually discriminating. And I'm pretty upset about this, because I already have I think 6 or 7 of my kids are put on hold, which they call the cases pended, and that means they're not getting funding while they're put on hold. And the reason what they're waiting for is for us to send graphic data, in some cases dating back 6, 7, 8 years ago, and we have the data, but the parents don't want to release the data because why should they? Right. Anthem was not even involved in the child's case before last year. And so there's some issues like this that are happening right now, and I'm very upset with Anthem about this. This is really pretty inappropriate for an insurance company, and it's shocking to me because Anthem has already once has gone through a class action lawsuit, and if they're going for it again, they're going to cause problems for themselves.
I hope that people are paying attention, and we covered it here on the show, to the fact that Kaiser did a settlement the other day to the tune of $9 million.
That's right.
And that was that's to cover the cost of services before it was the law of the land.
Right.
And I hope that insurance companies sit up, pay attention, because we're not going away, and we live in a litigious society, and we know how to do that if need be.
Right.
And autism moms are really busy, and autism parents in general are really busy, but don't tick us off.
Right.
We get really mad really quickly.
It just isn't right. I mean, I can't sit back and watch this, and I will be reaching out to a lot of more powerful sources than I. And I'm not going to let this go, because I see these kids. These are some of my kids who've been in the field for a while, who've been with me for a while, and the system has just completely unfair to them. These are kids who started out and they had some funding, let's say from the school district, and then or regional center, and the regional center reduced their funding and said, okay, now it's the school district has to share with us. Okay, well, the school district did for a little while and then dropped off, and then the parent had to fight again and get regional center to continue. But regional center wouldn't even fund more than, let's say, 10 or 15 hours. And then insurance came in and everybody was like, oh, wonderful, a new source of funding. And before you knew it, as soon as the insurance came in, regional center dropped off and said, hey, we'll fund co-pays. And then they, 6 months later, no, we're not even going to fund co-pays anymore. And so they're out, and now insurance has dropped them. And this is just not okay.
Yeah, it's not passing the buck.
Yeah, exactly.
It's unconscionable. And it kind of feeds right into, we had a follow-up. Hi, Dr. Doreen. I'm the parent that wrote about my child getting 10 hours of ABA through regional. I already started the process with CARD, and hopefully within 1 month I will start my child with full productive ABA. I already called your assessment office and started the process to get all 3 kids assessed, even though just 1 was diagnosed. When my son had the exit interview at the regional, the psychologist stated that he will continue services after 3 and that the school district will offer speech and OT. My question is, do I need to go through the school district and start the IEP? Does that mean he will start school at 3? But like I said earlier, I have started the process with CARD, and hopefully I will get him full-time like you recommended. Do I need to go through the school district? If not, how do we get him to interact with other peers? I'm so confused about this whole school district crap. Please help. Thanks again for all that you do, and God bless you guys. I talked a little bit about this earlier in the week because the question had come in, but I said that we were going to talk to you about this.
Yeah, I can easily answer that.
Yeah.
So it really depends on, first of all, your district and your other sources of funding. So if I knew which district you were in and which regional center we're talking about and what type of insurance you have, I could give you better advice.
I believe this was the Riverside one.
Okay.
If I'm connecting it with the same person, I'm not 100% positive, but I think it's the Riverside Regional Center.
Well, that would be inland. And so with inland, it's a little bit difficult. I don't really trust inland all that much personally, because they do change quite a bit, and it's haphazard. There's no real way of knowing. But what I would want to tell the parents is a few things. One is, at the age of 3, the regional center can potentially say you're at the age where in California school age considered 3, in other states it's 5, but anyway. So at 3, you do kind of become the responsibility of the school district. Having said that, you do not need to be attending school. You can also be doing activities at home. You could have preschool that's private. It doesn't have anything to do with it. It's just that the school district should start to participate. The likelihood that they will at 3 is minimal. It's more likely they will start actually funding something closer to 5. So, however, I really do recommend that Riverside, I do recommend that you do attempt to get involved with the school, get an IEP. What happens is you have a series of assessments done, and why not have your school district do it? Sure. They won't do IQ, but they'll do other types of assessments, testing, and they have to do that every 3 years. It's called a triennial assessment, and it's worth it because otherwise it's expensive to get it done. Now, the school, you should have the school do it without making the school think that you're going to be asking for special services. Because if the school has the impression that you're going to be asking for a lot of funding, then they'll make the, then I'm not sure how accurate or valid or reliable the assessments will be. Let's just let them assess, let the psychologist at school assess.
That's a really good point.
Without knowing why. I mean, it's your right at 3 to get your assessments done for entrance anyway, for an IEP, for the purposes of an IEP. Once you get the assessment, you'll take a look at it, and most likely what will be recommended is if there is a preschool program in the district, then they'll suggest you go to that preschool program. Otherwise, and by the way, the assessment process will drag on for a while.
Yeah.
Okay. So just so you know. Most likely there won't be anything if you, you can skip doing anything at 3. You don't really have to do any kind of schooling until 5 in California. But what happens with the regional center is they will start to reduce. So yeah, school might fund school and OT, which doesn't hurt. It's obviously helpful to get more and more. The more you have for your child, the better. So occupy the child as much as possible. But still, typically, we're still mainly receiving funding from the regional center at that point, even though they don't have to necessarily. The type of funding changes. So once school funding does come in, school then focuses more on language and academic. And maybe social, if we can argue that. Regional center funding focuses on adaptive, safety, those types of things, daily living. So like, if your child has issues like, my child runs away, that's a regional center issue.
Right.
My child is not toilet trained, that's a regional center funded thing. My child doesn't speak, that's more of a school district type thing. My child hits his sibling and it's dangerous, regional center. My child doesn't interact with anyone, probably both.
Right.
So it's kind of like, that's sort of the divide there. So yes, your best bet is to get about 15 hours from regional center and maybe 10 from school, and then later you can increase school. As child gets kindergarten age, you'll get some more hours from school, and then that way it'll add up to about 25 to 30 hours, which is great. That does not mean that you need to be going to school for 25 hours or whatever. Right. A lot of our kids, they go maybe 6 hours, 9 hours a week, and the school will fund a shadow. But they don't have to just fund a shadow. The school district could fund the entire program as well, just so you know. What they will tell you is, well, you're not in school, what are we funding? We're not going to fund anything. They could literally fund an agency like us, that's why we're called a non-public agency, to provide all the therapy around the clock. The only days that they wouldn't pay for are school holidays. That's it. The rest of the time they pay. In fact, some IEPs mandate them to pay through Christmas, through the summer, and so on. So you can have all that funding. If it starts to get litigious, I really do suggest you get an attorney. There are several attorneys that are very, very good at this. Bonnie Yates is an attorney who's worked with us for lots of years. Bruce Bothwell is another very good attorney. I think Bruce does a lot of work in Riverside. I'm not sure who else would. I don't even think any of my families have gone to court in Riverside or have required an attorney, but you never know. You sort of have to go with it. And they will fight both. They'll fight in the regional center and the school district if they need to. Yeah. Otherwise, they can just advise initially. Now, and by the way, if it ends up going to court, school district cases, and you win, the attorney gets paid from the school district. not from you, so that your attorney. So it's part of what happens when you take a school district to court. Now, insurance obviously is easier than all of this if you have insurance funding that is decent. As I said, you have a very young child, so you're not going to have a problem even if your insurance is Anthem, Blue Cross. You'll have, it depends on your type of policy. If you have insurance through your employer and it's an employer over 50 employees, then most likely you'll have coverage. Right. You can always contact our people here and they'll help you figure out if you have coverage.
Yes.
At CARD. And then that's our contracts department. You just call admissions, actually. And if you want to get into CARD, they should be checking your insurance coverage right now if you've already contacted CARD.
Absolutely. And just to summarize, it's interesting because we start out talking about the regional center and the school, but it always comes back to funding because they are places that will provide funding for your child to get the help that you want. Yeah. It is a process, and it does get complicated because you're dealing with different entities. And it's something you make peace with.
And all you have no choice. But the worst part of it is, I think that each entity tries to tell you that it's the other entity's responsibility, and actually it's everyone's. They are all responsible. I have kids who are 18 and still regional center funded, so there's no such thing as we stop at a certain age. They don't. Just their involvement changes. But and believe me, if you have an advocate, you don't really even need an attorney. If you have a parent advocate, they're not telling you the same stuff. The whole story changes.
Absolutely. But you get better at advocating for yourself, and you get the help and the support you need. And I think the biggest thing that I want to throw in as a parent is that it looks overwhelming and impossible. When you look at it and you go, I have to figure out funding to find this much funding, and I have to get it from a regional center, a school district, an insurance company. And you know what it's like calling your insurance company just on the phone, and they say, push 3 if you want to have this phone call continued, right?
My God.
And an hour later, you still haven't talked to a person. It seems overwhelming, but I would remind you that so many of us have done it. So many of us have done it, and we would all say to you, it's worth it. Get through it. Talk to other parents like myself and other people to say, how'd you do it?
Yes,
how did you work it? Who'd you talk to? How did you make sense of it so that you didn't completely lose your mind? Because we all lost our minds a little bit.
Right.
Let's be honest.
It's so true.
But so that you find the way to get through it. And it is you are able to navigate it. I can tell you firsthand.
Right. And it would be so good. I mean, I've talked about one of the things we're developing here is sort of the DG's list concept, where we have referrals that other parents comment on. I think it would be so awesome if maybe even on the same site, we're working on that, by the way, but it would be so great to have other parents, like a parent blog where you can communicate and write, because we have so many families on our mailing lists. It would be wonderful to be able to just write on there, are there other parents from Riverside? What's your experience been?
Exactly.
And they can tell you exactly what's going on in the area.
And that's invaluable information.
Yeah.
Invaluable, because then you don't have to reinvent the wheel.
Right.
And who has time to reinvent that wheel?
Exactly.
Fabulous, fabulous advice. I do have to say that we have a message. Yes, we're watching from Florida. We love you. Can't wait to see you here in Florida.
Awesome.
Thank you. We're so thrilled that you guys are watching, and so thrilled that we got to meet all of you. It was really, really great. Okay, another question here, scrolling back up. Somebody wanted to know, and this came from a person who is an adult. They wanted to know, how do you know if you have autism? A power pack question.
Yeah, that's a pretty amazing question. I guess, if you're a functioning adult and you've done well, you have a job, you have a family, or maybe you don't have a family, maybe you don't have close relationships, but you are functioning, perhaps you're not at your best, or you haven't been happy, then that's possibly what would be leading you to think, maybe I have autism. But nevertheless, if that's the case, in other words, if you're wondering about this as an adult, that means you're very, if at all, your limitations are very minimal, right? The things that you're wondering about are very, very minimal. So I suppose they would be things like the things that you would be thinking about would not really be in the realm of autism. They might be in the realm of, let's say, what we used to call Asperger's.
Okay.
So in most cases, when you start wondering about, do I have autism as an adult, you're really wondering, do I perhaps have sort of some signs of Asperger's, or maybe some signs of social communication disorder? And these signs are things like, I really don't understand people as a whole. I don't know what their facial expressions mean. I can't read people. I can't understand. I'm not very good at taking their perspective or understanding where they're coming from. Now, keep in mind, a lot of people are bad at taking other people's perspectives. So It's a little bit more drastic than that. It's kind of like, I just don't know how to handle people at all. A lot of times I find my adults with Asperger's really do have some other really spectacular skill. Like really, in other words, because you've had a weakness or an inability to understand social behavior, you've developed an incredible strength in some other area. Whether it's music or analysis, mathematical engineering, whatever it is, you're just a master at that. And so, you might be thinking of those things, and it's kind of like, I don't know, I don't really consider that to be a disorder for me. I just consider it to be something different. Because if you're functioning, and perhaps you're upset, like let's say you don't know how to get a girlfriend or a boyfriend, or a spouse or something like that. Well, you can learn those things. You can read about those things. You can take classes. You can talk to other people who are in the same boat. You can learn about those things. It's just like anyone else. It's like, I don't know how to balance my checkbook. Yeah, I can go get a class on it, and I can learn. I don't know how to change a tire. These are all necessary things as well for living, right? But or I'm depressed. Well, let's find out why you're depressed. Let's change your perspective on life. Let's help you find things that get you out of depression. Let's help you be less unhappy about yourself. All those types of things. So, not saying that you wouldn't benefit from some sort of specialized help or guidance or therapeutic help even, or educational or something, but let's not call it something that it's not necessarily. A disorder, it has to be debilitating. A disorder is, by definition, has to be something that makes you not functional in your home life or in your work or school life. Let's just remember that, including autism. I might have a child who's very asocial, but you know what? He doesn't care. He gets straight A's. He's a smart kid, and his parents are fine with it. Everybody's fine with it, but he's not a very social kid. So what? That doesn't make him have some sort of social disorder.
Right.
So disorder starts with something that interferes with the other aspects of your life.
Okay.
And again, even something like depression, for instance, you could be just have melancholy, but you won't qualify for a disorder of depression.
Great.
So the severity of it matters.
Okay.
And so don't worry about the label. I even tell parents whose kids do qualify for autism, don't get fixated on the label. Just break it apart and see what are the deficits, what are the strengths, and strengthen those areas that need to be strengthened. That's it.
Fabulous advice. And sort of hand in hand, somebody has written in and saying, well, how do I understand emotion? How do I read facial expressions?
That's terrific. So there's a lot of programs to teach you that. It's funny because one of my many of my older kids who've recovered come back and tell me that life is a little different for them. It's almost like they continue to always speak a second language. So, when you learn a second language, you're always kind of, even for me, English has been is my second language, but I've been speaking it since I was 4 years old, right? But still sometimes, and perhaps it's because there's too many languages in my head, but sometimes I can't find the right word in English. I just can't. I can find the right word in Farsi, Persian, or in some other language, French or something, but I can't in English for some reason, right? So I think people who overcome autism, some may have similar issues. They will always have to focus in order to make things go fluently. You know, it's kind of like aging. So, and they always have to learn things. It won't necessarily come naturally. Nick used to say to me that like there were so many things that he taught himself over time, he learned. And so how do you learn facial expressions? It's very simple. There's material out there. You can print out these things and you can look at the facial expression and you can memorize it. And then when you see it in people, you'll recognize it. Just like a 3-year-old wouldn't understand some subtle facial expressions, whereas when they're 10, they do. How do they learn that? They're exposed to it. They see it. And then they read other people's impressions about it. So, you know, just like you could look at a set of cards or videos and say, oh, okay, this is surprised, that's angry, and so on. More advanced facial expressions have been explained and described like that as well. There's a really good DVD. Simon Baron-Cohen's group made it. I forget the name of it, but it's, if you look up facial expression videos, you'll find it for sure. And it's training. It's training to show you the differences, of very subtle differences of facial expression. So that's one. Emotions, you read about it. You actually get psychology books. I mean, if you're that high functioning that these are the 2 main areas for you, you educate yourself about it. We do have a big section on this in skills. It's its own lesson, actually, emotions in the cognitive area, and facial expression, I think, is in the social area. But we have a lot of, if you look at our social curriculum, our cognitive curriculum, and our executive functioning curriculum, it's all this abstract stuff which is there. So that will give you a lot of information, and also a lot of books. There's been a ton of books written on this issue. Simon Baron-Cohen was the first person that came up with the whole concept of theory of mind, perspective taking, and his group at Cambridge in London, in England, Cambridge, they have a lot of books on this. Francesca Happy, Happe, she's written a lot of books on these issues. They describe it. Tony Atwood talks a lot about these types of things in his books. He has training tapes, so, and they're very easy to comprehend. So I would start there.
I think that's absolutely wonderful. Emily, we have time for one more, or are we done? She says we got, and this now I've left the big one for the last. Can you talk a little bit more about sensory processing disorder? We've had a lot of questions about that come in.
Yeah, sensory processing is a big deal. I'm trying to see how I can answer that in 2 minutes. So I guess the closest I think, first of all, okay, so let's just define it. First of all, this is many of our patients, clients, children and adults experience their senses differently than we do. They crave certain types of things like pressure or various types of tactile stimulation, or they will crave visual stimulation, or auditory even. I mean, some of them do crave making noises with their ears and so on. So, or they avoid certain sounds, visuals, like certain lights will bother them. They hear sounds much more like loudly than we do, certain sounds. They will hear things in the background that we're not even aware of, and that's loud for them and it bothers them. Whereas voice and language and so on will not necessarily be a loud sound for a lot of our kids, and so it's hard to focus on those things. So there's a lot of, so essentially that describes their senses are dysregulated. They're not receiving information through their senses the same way we do. Okay. Whether it's tactile or visual or auditory or whatever it is, proprioceptive even, like how their body is in space. They're not receiving information from the environment the same way we do. So as a result of that, they're they're made hyper or they're made lethargic. So just imagine if you have a massive amount of visual input, like lots and lots of lights flashing in front of you and so on, or the lights bother you, and so you're going to become a little bit more isolated or resistant or trying to avoid lights, or it might even in some cases cause hyperactivity, because it's almost as if certain lights that cause seizures and so on, it'll increase brain activity and you become hyper from it. If you have a need for tactile sensory input, you might feel very anxious, your skin's crawling. We have similar experiences, but we just don't have it as acute and as chronic. So it's like stronger, I believe, for our kids, and it's all the time.
Okay.
So because of that, when you have these types of issues and they're pretty severe, it's important to try to do as much as we know. We don't know enough how to do these things, but there are exercises, obviously, with lights and so on. What do? You wear glasses, you wear sunglasses. So a lot of our kids, we have to be just cognizant of the fact that the visual input could be bothering them. So a lot of times we try to not have fluorescent lights, because we hear that they can possibly, the flickering, they see it. We try to be very aware of our kids' noise, how noise and sound disturbs them or bothers them. And that means, if you see the child like just distracted, wonder to yourself, are they listening to something that you can't hear? These are things to pay attention to. And of course with tactile, that we do a lot of exercises. Like some of our kids really do benefit from big squeezes, or feel safer if they're covered, their clothes are covered. We massage our kids, we roll them in a blanket, and we give them the experience that allows them to feel a little bit more secure in their own skin. And these types of things actually do reduce the child's hyperactivity level when necessary. And in some cases it wakes the child up, because sometimes our kids become just lethargic.
Okay.
So, in a nutshell, that's how I see sensory integration problems.
So one question, in terms of the new diagnosis, is it a separate diagnosis from autism?
No,
it's part of autism.
Yes, it's just considered one of the symptoms now.
Okay.
Yeah.
Great.